Good morning, everyone, and thank you for joining us today for this week's epidemiological summary. As usual, we will begin with talking about our cases in Canada, moving on to what's happening in Ontario, and wrapping up with some additional details in Windsor-Essex. Looking at our epidemic curve in Canada, we are noticing that our cases here are incrementally increasing, though they have remained relatively stable for the past 7 days. Looking at the 7-day average, currently it sits at 2,518 cases a day, whereas in the past 7 days it was at 2,400. So we've noticed a slight increase, but once again, it has been incremental. Moving on to what we're seeing in Ontario, the current 7-day average is 656 cases a day. This has increased from where we were last week, where we were at 579 cases a day. When we look specifically at the curve, you can see that the 7-day average and case counts are trending upwards. So now looking at Windsor-Essex and our case counts and 7-day average. Just like what we're seeing in Ontario, our current 7-day average is increasing. As of now, our 7-day average sits at 46 cases per day, whereas in the past week we were at 36 cases a day. When we do a week-to-week comparison of our rates per 100,000 population, for our most recent completed week, our rate has increased to 73.8 cases per 100,000 population. This time last week, we were at 59 cases per 100,000 population. This is about a 25% increase. Looking at the most recent 7 days, and just like with the full weeks, it's currently sits at 74.5 cases per 100,000 population. And in comparison to the most recent 7 days for the past week, it sits at 63.9 cases. So just as with our completed week, this has gone up. So how do we compare with other PHUs across the province, and specifically those in the Southwest? When we look at our case rates, which is in the blue line, you'll see that it has increased, and it's increasing at a faster rate compared to those in the Southwest, in Ontario, which is the green line, and all of Ontario, which is the orange, though across the board, case rates are increasing. So how do we compare to other PHUs in the province for the most recent completed week, which is from November 14th to November 20th? Though our case rates have increased for this past week, there are other public health units, such as those in Timiskaming, Algoma, and Sudbury, the northern public health units, where the rates have been the highest. We currently have the 7th highest rate for the most recent completed week. Now looking at our wastewater surveillance data, while it has generally been high for most of November, we did also see a dip as the months progressed. Though recently, this past week, our wastewater surveillance data has also shown an increase. Now when we look at our percent positivity, for the most recent completed week, our percent positivity is 4.8. This has relatively remained unchanged from where we were last week. Now comparing our most recent 7 days percent positivity to those across the province for the most recent 7 days, Windsor-Essex has the 4th highest percent positivity in Ontario, and it sits at 4.8%, though other jurisdictions in Ontario such as Haldimand, Norfolk, Southwestern, and Algoma are ahead of us in terms of their percent positivity. Now moving on to what our percent positivity looks like for our age groups, you'll notice that looking at the most recent few days, our percent positivity has increased across the board. This is true in terms of what we were seeing last week again, but this time though, we are seeing some of our older age groups, like our 65 plus, where the percent positivity has shown a dramatic increase. Now moving on to our case rates by municipality, and since November of this year onwards, Leamington, Tecumseh, and Essex have had the highest case rates. When we strictly look at the distribution of cases for the past 30 days from October 25th to November 23rd, 45% of the cases are from Windsor, 11% from Leamington, and about 9% from Tecumseh. In the most recent 7 days from November 17th to October 23rd, 46% of our cases are from Windsor, and there seems to be about an equal distribution of cases across the other municipalities. So looking at our age and gender breakdown, for this, for the past 2 weeks, we've seen once again a high number of cases in our 0 to 19 year age group, where currently it sits at 23%. Almost a quarter of our cases are from a 0 to 19 age group. Now breaking down the source of acquisition for how our cases are acquiring COVID-19. About 33% of our cases, a third, do not know the source of their acquisition. Just over 25% or a quarter of our cases have acquired COVID-19 from their household contact, and 21.5% of our cases have acquired COVID-19 from a close contact that's not from their household. Now focusing just on our school-aged children, our 7-day average and our case counts are once again increasing to levels where, in terms of what we're seeing at the beginning of our fourth wave here in Windsor-Essex. Currently a 7-day average is at 9 cases per day, whereas this time last week we were at 6 cases a day. When we compare our 7-day average for our school-aged children to our entire population, you'll notice that there is more of an increase, or a sharper increase in terms of our 7-day average in our school-aged children, which is the green line, though we are also seeing an increase as well in our overall population. So now looking at our hospitalizations in Ontario and in Windsor-Essex, hospitalizations in Windsor-Essex has increased once again from last week, while in Ontario it has remained fairly stable, with some incremental fluctuations here and there. The ICUs, however, tell a different story. Yes, we've seen some variation, but in Ontario and in Windsor-Essex, they have remained fairly stable for most of November. So this is a new slide. Last week we had presented our vaccination for our cases in Windsor-Essex. This week we're looking at the rate of vaccinations in our cases. In our unvaccinated age group, in our unvaccinated group from November 15th to November 21st, our case rate per 100,000 was 130 cases, whereas in fully vaccinated it was at 52. So looking at the relative risk, it's 2.5, which means unvaccinated cases are 2.5 times more likely to acquire COVID-19 compared to those who are fully vaccinated. Remember, once again, this is only for last week. When we move on to hospitalizations, all hospitalizations for COVID-19 for the past week, the case rate for those unvaccinated who are hospitalized was 13.3 cases per 100,000 population, whereas those that are fully vaccinated, the case rate was 2.2 cases per 100,000 population. The relative risk was 5.9, meaning unvaccinated cases are 5.9 times more likely to be hospitalized for COVID-19 compared to those who are fully vaccinated. Drilling down a bit further and looking at our ICUs, the rate for our unvaccinated cases who are being hospitalized in the ICU is 4.7, whereas those who are fully vaccinated, the case rate is 0.3 per cases per 100,000 population. The relative risk is 14.8, meaning unvaccinated cases are 14.8 times more likely to be hospitalized in the ICU for COVID-19 compared to those fully vaccinated. Now moving on to our doubling time. In Canada, our doubling time has continued to stagnate, though we have seen some minor increases overall. In Ontario, we are seeing a decline in our doubling time, highlighting an increase in cases. The same can be true for Windsor-Essex. Our most recent median R naught is 1.1. This is slightly lower from where we were last week, where we were at 1.3. When the R naught is higher than 1, each existing infection leads to more than one new infection. This indicates that our cases are increasing in our region. So moving on to our vaccination progress in Windsor-Essex. Looking from October onwards, this slide looks at our first, second, and now third doses. Zooming in onto the orange bars, which is our third doses, you'll notice that we have seen an increase in our third dose administrations locally in our region. Currently, the 7-day average as of November 1st for first doses was 127 doses per day and 228 for second doses. For third doses, we are administering about 862 doses a day. When we look at our vaccination coverage rate by age group, just like we were last week, we are seeing incremental improvements in our younger age populations, whereas we've seen a very high coverage in our older age population. The overall coverage rate for at least one dose for all residents in Windsor-Essex, including children who are not yet eligible to receive the vaccine or have not yet received the vaccine, is 76%. When we look at our fully vaccination status, the overall vaccination coverage rate for our entire region from zero and up is 73%. Focusing on our geographical distribution for our coverage rates, and this includes all residents, including children, there continues to be some work to do in certain areas, such as the NOP postal code, the N9A postal code, and our NAT postal codes. Just like with first doses, like our second doses as well, there are areas similar to what we were seeing in our last slide where we can improve our coverage rates. So when we look at ourselves and compare ourselves to other public health units in the province, for first doses, we are actually now in the middle of the pack, though we're slightly below the province in terms of the overall coverage rate. When we look at our second dose coverage rates, however, we continue to be on the lower end. So there is still some work to do to better improve our overall fully vaccinated coverage rates. In summary, case rates in Windsor-Essex have once again increased this week. Our wastewater surveillance data has also indicated that there is an increase. We continue to see a disproportionately higher number of cases among children and youth. COVID-19 hospitalizations in our region has increased, but ICU admissions for COVID-19 remains generally unchanged. The majority of the doses that we're administering currently are third dose booster shots. And when looking at our monitoring indicators, for our most recent completed week, our case rate is 73.8 cases per 100,000 population. For the most recent 7 days, it's 74.5 cases per 100,000 population. For our full week, our most completed week, and our most recent 7 days, our percent positivity sits at 4.8%. Our R naught continues to be above 1, and sits at 1.1. Outbreaks in our region continue to be very high, over 30 outbreaks currently. Our first dose coverage for those 12 plus is 86.6%, and 83.2% for our fully vaccinated 12 plus age group. Thank you very much.